Good afternoon, everyone, and welcome. It's 1:01 Central Time in Louisiana and Mississippi. This is a support hour for hospices and home health agencies that are operating in Louisiana and Mississippi. Today, we will be specifically looking at Louisiana's region number three, which is basically Bayou Country, Southeast Louisiana. Houma, Thibodeau, Assumption, Lafourche, St. Charles, St. John, St. James, St. Mary, and Terrebonne parishes. And we are almost at the 40% mark in terms of where we are in the hurricane season. We will be starting up. Oh, that's the wrong date. It should be August 7th. The rest of the calendar, today's August 7th, we're looking at Louisiana region number three. Next week, we will be doing a tutorial on the, can you hear me? You can hear me? Okay. We will be doing a tutorial update on the at-risk registry. So if you have folks in your office who are not quite sure how to work the registry, please ask them to get on next week's call, and we're going to walk through the at-risk registry, how to put patients in, how to take them out, how to update them each week. We'll go through the entire process so that they'll be much more familiar, much more comfortable actually putting in doing the input. I have gotten confirmation that Noah will be on the 21st, August 21st call, giving us an update as to what the tropics look like at that point as we reach into the peak of hurricane season, which is which we'll be entering next week. The peak of hurricane season goes for about 4 weeks, the last 2 weeks of August and the first 2 weeks of September. And you can find all of these past recordings. Every one of these sessions is recorded so that people can always refer back to them. That's what those hyperlinks are for. And you can find all of this list on our website at lmhpco.org under professionals for emergency preparedness. I want to remind everyone that the prediction on May 1st for this hurricane season, you can look at that recording and those slides and compare to see what was actually predicted and what we're having thus far. Now, they predicted a total of 23. We are at Debbie. So we've had four named storms so far. They're saying that there were going to be 11 hurricanes, 23 named storms, 11 hurricanes, five would be major, and that Louisiana, there was a 23% chance that Louisiana would see a direct hit, 13% chance that Mississippi would see a direct hit, and that there was an 81% likelihood and the probability that their prediction was going to be correct. So that they are actually saying that they saw back in May 1st a lot more activity in the Atlantic basin than they did in the Gulf, but we've already seen some three named storms come into the Gulf since the beginning of this hurricane season. Again, the constant mantra, best practices in terms of hospice and home care agencies taking care of patients in any disaster. But if you are a home care provider, these are things that you must do. Have you submitted your plan to your emergency manager? I still hear cases where agencies have not yet done so. There is a template for both Louisiana and Mississippi providers to use, and that template is to go to your emergency manager. Your emergency manager is the emergency manager in which your office is located, either in that parish or that county. You need to send it there. We suggest best practice that you send that emergency plan, not only to that emergency manager, but to every emergency manager in the in your service district. That means all of the parishes, all of the counties that are included in your service district. Every hospice, every home care usually serves about a 50-mile radius that you include all of the emergency managers. Because while your emergency manager in your parish may do things one way. The emergency manager in the next parish or county may do things a little differently. And it's important that you know what those differences are. Everybody does it a little differently. Every district, every region does it differently. They process the information that's sent to them differently, and you need to know how they're doing that. We suggest that you not only send your emergency plan to those emergency managers, but that you actually make the effort to go and meet them. Either meet them at their quarterly healthcare coalition meetings, or make an appointment and just go and see them in their office. Bring them cookies, bring them a pizza. Make sure that they know who you are and what you represent in terms of your patient population, so that in the event of an actual disaster, they know who you are, you know who they are, because relationships simply matter in a disaster. Are you using the at-risk registry? Well, we'll get to that in a little bit, but I just looked at like Region 3. We have 44 agencies that have patients in the registry, that are being sent to emergency managers in all of those parishes we just mentioned. It's an easy tool to use. It makes life simpler for the emergency managers if they can get that list, one list, rather than lists from all of the different agencies that are servicing their particular parish or county. There is a consent form that's required that patients sign in order for you to put their information into this registry. There's also, we capture about 44 pieces of information for each patient, and it's important that you collect that information and put it into the registry. That's what that evaluation form is about. That's hyperlinked there. Is someone in your agency responsible for putting in this information and doing that update each week on those patients? We send out a reminder each week. If you're not receiving that reminder, then just give me a call, drop me a line, let me know that you want to, and we'll put you on that list. It's simple. It's just a simple reminder. It goes out every Thursday morning at 7 a.m. to all of the users, because on Friday morning, we send out reports to all of the emergency managers across Louisiana and Mississippi. When you're talking to your emergency manager, it's important that you find out from him or her if there are any special protocols for re-entry into your service area. Some parishes, some counties require a particular placard be used. Others do not. They require that you have a letter from the employer that you are actually an employee of that agency. They require that you have a name badge representing that agency in order to get through any type of roadblock or stop, parish stop or county stop. So you need to know what those rules are. And then finally, do you have contracts in place or a mechanism in place to transfer patients if there's an evacuation call for your particular community? If your patients are going to a particular place, you know where they are going. Have you made arrangements in terms of transferring care to another agency, or are you contracting with other agencies to provide the continuity of care to your patients? Those are very important issues for each home care and hospice provider in Mississippi and Louisiana to know. Okay? Any questions thus far of anything I've said? Okay, we're going to move on. I want to remind everybody that disaster does not occur Monday through Friday from 9 to 5. our regular business office hours. Disasters usually happen at the most inconvenient times, usually on weekends and holidays. Just look at the last few hurricane seasons in terms of Labor Day, and you'll see how many of those were interrupted. How many of those Labor Day plans were interrupted because of tropical systems, as was the case in Ida. If you haven't done so yet, it's really important that you do a tabletop exercise with your staff, that your staff knows what their responsibilities are in an emergency, what your agency's responsibilities are, what their responsibilities are, and that everybody knows what the plan is. There are two excellent recordings that we're providing here that were done by the folks in Region 2 for us on how to conduct a tabletop exercise and then an actual tabletop exercise. You can refer to those in terms of learning how to conduct one in your particular office. Do you know where your staff is planning to go if there's an evacuation order? You should know that. Do you know where your patients are planning to go if there is an evacuation order? You should know that. You should also know when you're talking to your emergency manager what your emergency manager's plans are for any of the patients that are needing assistance in evacuating. Where they're going to be taking them to? Well, what's the plan? And finally, do you have an alternative way of communicating with not only your staff, but with also your patients in the event that landlines and cell phone towers go down, as they always do in hurricanes? So, do you have an alternative way of communicating? Today, we are going to focus on Region 3, the little Bayou region, which makes up, let's see, St. John, St. James, Assumption, St. Charles, St. Mary, Terrebonne, and Lafourche Parish. And those providers that are in in Region 3 today, you want to take note of the regional managers for Region 3, but I know some of you also may have patients that spill over into Region 4, so we're providing you with the contacts in Region 4 as well as the contacts in Region 1, because there's some folks that are down in the Bayou country that also come into areas of Region 1. So we'll give you that. This map should be those providers in Region 3. You should have this map in your emergency plan. It also gives you the contacts on the state level for GOSEF. And you can you can always find all of your emergency managers on our website under on the emergency page. It will lead you straight to their contact information. With regards to home care and hospice, we have two DRC designated regional coordinators in Region 3 who've accepted the volunteer role of helping hospices and home health with their patients in an emergency. I think they're with us today, Amy Champagne for home health and Laurie Gallagher for hospice. Are you
Hey,
both on?
hey, Jamie, it's Lori. I'm here.
Thank you, Lori. Thank you for being here. And please feel free to jump in at any point if you want to say anything to your fellow hospice folks. Is Amy on today's call? Okay. Well, but Amy Champagne is the DRC for home care. So if you want to make contact with Amy, please. This is about patient care. They are a lot closer in the region, and they're working with Kim Betts and the folks in Region 3 to make sure that patients are being taken care of before, during, and after a storm. I think Kim is with us, correct? Kim?
I am here.
Kim, and please, again, please jump in at any point. I have your slides all loaded for later on, but at any point, please interrupt me if you have anything to add to what I'm saying.
I'll do. Thank you so much.
Thank you. Thank you for being here. I want to talk a little bit about the at-risk registry for those of you who are on for the first time. This is a registry that's required of home health and hospice providers in Louisiana. It's encouraged, highly encouraged, and recommended for providers in Mississippi. Why? Because it fulfills your agency's responsibility with regards to emergency prep, the conditions of participation that Medicare has put out in terms of it requires you having a mechanism for connecting those patients that would have a problem evacuating on their own and connecting them with the emergency manager in their county or in their parish. It keeps emergency managers aware of the special needs of your patients. And I want to remind everybody, this is not a registry for any nursing home patients. Nursing homes have their own plan, evacuation plan, and your patients that are in a nursing home fall under their jurisdiction. So this is just about your patients who are living outside of a nursing home. And we're still trying to decide whether or not, I think assisted living facilities, your patients would fall into the registry because assisted living facilities, I don't think are licensed. But I still don't know what their status is because I know that the legislature was looking at particular issues around assisted living facilities after Hurricane Ida, and I'm not sure where we are with assisted living facilities. So you need to find out from your emergency manager whether assisted living facilities need to be included on the registry or not in your particular parish. I also want to point out that 76 patients right now in the registry are missing either the parish or county assignment, and 75 are missing zip codes. While the zip codes are important because of geo-syncing patients and first responders, the parish and county assignment is really crucial because the patient information is in the registry, but it's simply not going anywhere because it wasn't assigned a parish or a county. So when you are in the registry, you need to make sure that that parish or that county, that patient is assigned the correct parish or county. And I know I get reports from emergency managers that agencies have misplaced them or assigned them in a parish they're not in. And we go back in there and we correct that. But it's real important that agencies pay attention to what parish or what county your patient actually lives in and make that assignment in the registry. This registry is for 4 different types of patients. Patients who are living alone without a caregiver and would be unable to evacuate themselves if there was an evacuation order called for their neighborhood, or home health or hospice patients who have a caregiver, but that caregiver is either physically or mentally not capable of carrying through on an evacuation order, or those patients' families that don't have the financial means to evacuate. Evacuation can be costly. Before the pandemic, it was estimated to cost a 3-day evacuation was estimated to cost about a family of 4, $750. I'm sure now it's over $1,000. Emergency managers have other resources available to them, such as hotel vouchers, gas cards, food vouchers, things of that nature that they might be willing to give to your patients that you're identifying as financially not able to evacuate. Otherwise, they would evacuate. Otherwise, they would be capable of evacuating. Your emergency manager would be more than happy to share those resources if they don't have to worry about that particular patient and family, if they can give them those vouchers so that they can literally get out of town ahead of a storm. So that's why it's important that you identify the reason you're putting the patient into the registry. And then finally, the
Jamie,
fourth category. Yes, sir.
on vouchers, they would need to check with the parishes because a lot of them don't have those vouchers anymore.
That
That was way back when on different storms, and depends on what it is.
it depends upon the resources of the particular parish or the particular county. Some parishes do, some parishes do not. Yes, sir. Thank you. Thank you for that clarification. And then finally, patients, families that are simply refusing to evacuate. We all have those. We all have those patients in our agencies. To just, they need to know that that's the reason that you're putting them in the registry. Every Thursday morning at 7 a.m., we send out this notice to all of the agencies across Louisiana and Mississippi, reminding them to do the update. The update is very important. If your agency doesn't do the update, your patients are not included in the Friday morning report. I don't know how else to say it. That's the only way that we can ensure the emergency managers that the information we're sending them about patients in their region is accurate and correct. About 25% of hospice patients that we enroll are deceased within 7 days of enrollment. Half of all of our patients are deceased within 30 days of being enrolled into hospice. Agencies disenroll home health patients all the time. They finish their episodes, and that it's done. Those patients need to be taken out so that emergency managers know that this is a clean a report as we can provide. We send out over 1,000 reminders each Thursday. Last week, 900, over 900 were not even open. Now, some of that may be because those folks are no longer doing home health or hospice work. They're no longer involved in the at-risk registry. Some of those may be sitting in your junk folder or your spam folder. It's important that you check your spam folder and give permission to get into your inbox if you're not seeing it in the reminder in your inbox. Some of these are sitting on the other side of your firewall. And the only way that we can get through is by you contacting your IT department and asking them to allow that particular message each week to come in to your inbox. As of last Friday, I'm sorry, as of yesterday, when I did I took these numbers yesterday, I pulled down the reports yesterday. We have 1,400 hospice patients in the registry. Over 1,000 are identified as would need assistance. 38 hospices have 452 patients in the registry that they did not update last week. My question to those 38 hospices, or why do you have patients in the registry if you're not updating them? In terms of home health, we have a little under 1,000 home health patients in the registry, when over half of them would need assistance in an emergency. There are 44 home health agencies that had a total of 429 non-updated patients in the registry last week. My question to those 44 home health agencies is, why do you have those patients in this registry and you didn't update them last week? Okay. We'll be getting into some more specifics. The 38 hospices that did not update patients last week, this is that list. If you're highlighted, you are a hospice in Mississippi. So if you see your name on here and you don't know why your name is on here, I need you to contact me so that we can investigate and find out why your patients were not updated last week. Maybe you thought you did correctly. Maybe they were not done properly. I won't know until we get together and we find out why they were not updated. So we have 38 hospices. If you see your name on here, contact me. If you see a branch of your corporation on here, please contact them and have them contact me about seeing what we can do to eliminate these patients that are not being updated. In terms of home health, we have 44 home health agencies that did not update a total of, what did we say, 424 patients last week. This is that list. These are the 44 home health agencies, and these are all in Louisiana. There aren't any, I don't think we have any, or not a whole lot of home health agencies in Mississippi that are currently using the system. But so these are all Louisiana providers. And now today we're going to be focused in on Region 3, and there are 34 different agencies in that service Region 3. We had 213 patients identified needing assistance in Region 3 for this week, okay? And it's a breakdown of those, or the parishes and the numbers of patients that would need assistance today if there was an evacuation order called for in those parishes. There were only 11, and I have to give it to all of the providers in Region 3 for doing an outstanding job. There were only 11 patients last week that were not updated, and those 11 patients belong between these 1, 2, 3, 4, 5, these 6 agencies. If you're hearing this message and you're on my naughty list in Region 3, please contact me so we can figure out why your patients are not being updated. Any questions for Region 3? Okay, well, Kim, I'm going to turn it over to Kim Beats in Region 3 and the other folks that are in Region 3 to provide us with some context for what's going on in Region 3 and the expectations as we head into the peak of hurricane season. Kim?
Hey, Jamie. Okay, we do have some of the OEP directors on the call with us today. If anybody has any questions for Lafourche, St. John, St. James, Terrebonne, St. Mary, I think the Assumption's not on the call, but if you have a question for them, they'll be here. And Charles is going to go ahead and start the presentation, and then Mr. Jimmy's going to take over for the Highway 90 contraflow or evacuation process.
Thank you.
Charles.
Thank you. And Charles, Mr. Cannon, thank you.
All right, thank you for the lead-in and for providing us this forum to connect with our community partners and look after our vulnerable populations. So Region 3, we call ourselves the River and Bayou Parishes. You've mentioned that we cover Assumption, Lafourche, St. Charles, St. James, St. John the Baptist, St. Mary, and Terrebonne parishes. Of course, we're a coastal region, and we've recently been hit by strong storms such as Hurricanes Ida and Gustav. So in advance of an approaching storm, the State Surgeon General is now responsible for determining activation of medical needs shelters. So he will activate the medical needs shelters, which will trigger us to open up our triage lines. Region 3, Office of Public Health plans to perform telephone triage. We're going to utilize LDH staff working out of our regional EOC. The triage phone numbers will be advertised on 211 and other established media, and those triage phone numbers are also listed here. If you have a client who you know will require placement in a medical needs shelter, please use the Before OPH Triage Lines Are Activated section on this page to pre-list your client. You could also call directly to OPH. We are maintaining a small list right now of agencies, caregivers, and clients who have contacted us that may need placement in the shelter. Next slide, please. And so once the triage lines are activated, a patient or their caregiver can call on the triage line and speak to one of our LDH nurses who will go through the medical needs shelter application form to determine if the caller meets criteria for medical needs shelter admission and also transportation needs. Non-ambulatory clients will go on a list that is distributed to Region 3's EMS DRC, who will ensure ambulance transport to the medical needs shelter. And Office of Public Health will coordinate with the Parish Office of Emergency Preparedness for those that meet criteria for paratransit transportation. I believe many of the parishes are using Council on Aging buses or other resources. Our region has several evacuation considerations, and GOSEP administration has expressed the likelihood of using a bus farm in Baton Rouge. These clients will be transported to Baton Rouge and rebused on state buses for transport to their end destination. And we do ask that anybody who does need to go to those medical needs shelters, that they leave a porch light on or other power indicator when they leave their residence. Next slide. And so the medical needs shelter criteria includes persons requiring assistance with medical care administration, monitoring by a nurse, dependent on medical equipment, requiring assistance with medications or mental health disorders. Also included are those stabilized and requiring urgent medical support, but not acute care. Persons with disabilities or requiring personal care services, but no emergent medical conditions will be referred to a general population shelters, and those acutely ill would be best served with hospital admissions. Our state shelters are staffed by public health and other LDH nursing staff. They're asked to perform duties that they do not perform on a regular basis. We offer annual training on specialty care services so that they may be better prepared. If you have a client in one of our shelters, we ask that you please make sure to visit and check on them. Our nurses are not familiar with your patient and can benefit from your knowledge and experience. Next slide, please. And these are our state shelter locations throughout the state. Region 3, we generally consider ourselves an evacuating region. If we see a storm, we want to get people away from danger. We have 2 shelter locations identified in Region 3. The location at Assumption Community Center is considered a pre-storm location, and Betsy Sheremy IO Hall at Nicholls State University in Thibodaux is listed as a post-storm shelter location, but that will always depend on the Surgeon General's orders. Region 3 has not opened a local medical needs shelter since 2008, as the case may be at this time. And next slide. Put a picture in of one of our medical needs shelters. I believe you've probably seen these if you've been following the ESF8 Lunch and Learns here. You see the cots. It doesn't look like a fun and exciting place to stay for a week. Right. Reminder, it is a shelter of last resort. Also co-located with the medical needs shelter in Alexandria is a general population shelter, also a pet shelter. There's lots happening around that region. Service animals are only allowed in the medical needs shelter. Next slide. Once arriving at a medical needs shelter location, each client will be re-triaged. We'll also offer medical assessment and treatment when possible, limited pharmaceutical services, generally consisting of over-the-counter meds, transportation for medical care services, mental health counseling, security, meals, and discharge planning. And I mentioned earlier, leaving a porch light on when a shelteree leaves the residence. Next slide. We ask that you please make sure to have available identification and medical insurance cards, 5 to 7 day supply of medications. Also bring either a detailed list of medicines or original pill bottles. Doctor's orders, we're especially looking for DNR orders if they have those, home health or a hospice folder. Medical supplies, including wound care, tube feeding, colostomy, and oxygen equipment. Medical equipment or assistive devices such as walkers, wheelchairs, IV pumps, and blood sugar monitoring. Personal items like soap, shampoo, clothing, eyeglasses, and diapers. Phone, and don't forget a charger with the phone because the phone won't work without being charged. Emergency contact information I find is very important because the social connections become misplaced following a disaster at evacuation. And for pets and service animals, food and vaccination records as well. Next slide. We mentioned bringing a 5 to 7 day supply of medication to a medical needs shelter. This is a reminder that a pharmacist may dispense a 30-day supply of medication following a disaster declaration. Medicaid will waive copays and also allow for early prescription refills. And private insurers can contact the support desk for instructions on early prescription refills. Next slide. Past hurricanes in our region have led to supply chain disruptions. Office of Public Health is prepared to implement an oxygen exchange program for those unable to receive oxygen supplies through their traditional suppliers. If OPH begins oxygen exchange locations, the oxygen exchange, these are the locations and contact information to find replacement canisters. And now I will go on to the next slide and pass it on to Jimmy Broussard.
I have one question about the oxygen exchange. This is set up post-disaster, right? Not pre-disaster.
That's correct. And only if we're unable to get in touch with their DME providers, if they're not able to receive oxygen.
Thank you.
Yes, Jimmy, can you hear me?
Yes, sir.
Okay. Go to the roadways file. So there we go. Next slide. Hey, this is a lot of cars in the picture here. What we have in the St. Mary Parish and Iberia Parish, Highway 90 is having major road construction conducted at this time. And it's going to last probably till next year. We have single lane traffic on Highway 90 on one side in St. Mary Parish, and it's about 6 miles long. Next slide. As you're going down there, we get to that construction site, and 18-wheelers are going to be getting into the left lane on Highway 90, closer to Franklin. Cars will be able to exit to go around and bypass to LA 182. That's the old highway. And you can go through Baldwin and then Generate and so on. Or you can get back after you get past Baldwin, get back onto the 4-lane. But it's all single lane traffic. If you have a breakdown or this wheel that breaks down or gets in a wreck, you're talking about at least an hour to clear the accident scene up and get cars moving again. So everybody that comes through St. Mary needs to prepare to exit to 182 if the traffic gets snarled, backed up, or whatever. So that also means when you get to New Iberia, it's going to be the same condition. All the side roads and all that, they're open. LA 182 is open. When you get to New Iberia, 40 Orchard Road is going to be open, and your side roads are going to be open. Access lanes. Now these bypass roads that they're going to have is for you to get north and west. Okay. When you get to New Iberia, it's going to open up to where you can go to St. Martinville, Bridge. You can go to Broussard. And then when you get to New Iberia, you can also go to Abbeville, Delcambre, and all of that. Head west. Most people that evacuate through St. Mary and Iberia want to head west because that means the storm is behind them coming from Florida towards us or whatever. Main thing that you're going to need to know in this condition is to leave early and that be prepared to stay in traffic for a while. So top off your gas tanks. Before you leave Franklin area, if you have part of a tank of gas, refuel in Franklin because the next stop is not till like 30 miles away to another gas station. So that's the reason for exiting Franklin area if you get low on gas. You could fill up Morgan City, Patterson, and after that, Franklin would be next. So top off your gas tanks. Next slide. That's what you can see for 6 miles in St. Mary. And you'll see 3 miles of this in Iberia Parish. Next slide. Okay, this is what I was talking about. If you can see, you see my asterisk moving?
Mhm.
Okay.
Yes.
The green highlighted section there, your service roads are in pink, and your main highway is in blue. So those are the options you can take in case Highway 90 gets, blocked up or whatever. You can take those other exits and get back on later. Some of the things DOT put out, they're going to have some road signs there in St. Mary Parish to use the LA 182 as an alternate route. And then you can get back on Highway 90 after you pass the construction site. Preparation is key in this. You have to bring food, water, and your medications with you and be prepared to be stuck in traffic for a while. The only way you won't be stuck in traffic for a while is to leave early. If you're retired or something, out of school, whatever, and you know the storm is coming, leave early. Prepare yourself and leave early is the best option to take in this case. And next slide.
Mr. Guidry, one question.
Yes.
And I don't know if you have an answer to this, but if there is an evacuation order called for this area, do you have any idea as to the number of folks that would be on the road evacuate? An estimate as to how many folks
They've done
will
studies
be?
in the past years and things like that. And one thing to point out is that, like Katrina, they did road
Yeah.
counts to tell you how many cars passed by, and it was hundreds of thousands. But
Hundreds of
you
thousands.
had the largest number of cars to an hour passing through St. Mary versus any other area because it was 4 lane and it was unobstructed. But now you're going to have obstructions with
Not going to be
public,
obstructed.
so it's
Yeah.
going to be
Yeah.
difficult. And yeah, you got 50% or more citizens from your parish that's going to be leaving to evacuate. But you got to also figure you got buses from the nursing homes, the school buses traveling on the road from shelter to bring the public. And they're going to be leaving. The other parishes going to be coming through us. So by the time we get ready to go, the road's going to already be blocked,
Right.
So you have to look ahead. That's why the main key in all of this is to leave early. It'd be the best thing. And be prepared to take your medicine and food with you because it's going to be a long ride. Yes, go ahead.
When you say leave early, how many days before landfall are we talking about?
Okay, in some cases, that you have some storms. It depends on the exact nature of that storm that's coming.
Right.
And
Right.
if the weather service can help us predict and everything, but you have rapid intensification,
Yeah.
rapid strengthening, and increase in speed.
Yeah.
So it's a guessing game at some points.
Yeah.
But if you know this storm is a big storm and it's coming towards you, it's got a 200-mile path that it's going to take or whatever. So it's like a funnel. You figure it out if you're in the funnel, and,
Right.
and if you are not working or anything like that, take it upon yourself to leave early. That's the best thing you can do in this case. And if all is good after that, then it's no problem. You had a mini vacation.
Right.
But
Thank you.
that's the key that they've always put out right now, especially is to leave early. Now we've talked to the people in Iberia Parish, DOTD, and we got the business bureau going around talking to the service stations to make sure they tank up, especially ones along the route, that they don't run out of fuel and everything else. And as a key, also remember that we're not going to have shelters in our parish.
Right.
That's why we're evacuating. Now, if you get stuck in a storm and traffic and everything, yes, we could open something emergency-wise to get people off the road because people die just driving in traffic in a storm. Like the past storm that we just had on the East Coast. They had 6 or 7 people died already.
Yeah. Exactly. And that was what a category 1.
Yes, category 1 or less, and like an 18-wheeler truck driving on the highway in the middle of a storm over a bridge, and he runs off the bridge.
Exactly.
So, okay, and this right here shows you the construction area that's in New Iberia that's going on right now as we talk. And there's no exits to get off, so you have to exit before you get to New Iberia. If you need to go to Highway 14 this way, you'll have to exit up here, take a side road. It's going to be a detour sign available. That's what those markers are for. And DOT will have that marked with the sheriff's office.
Are there any estimates as to how much more time it's going to take because of the construction for evacuation to take place from Bayou River region? With these construction projects, is there any estimate as to how much more time it's going to take folks to evacuate?
Well, I'll put it right now. If you're leaving the traffic right now for work and all that, you're going to have your normal work traffic, and there's going to be a little slowdown, but you're able to get through Franklin to New Iberia in 30 minutes.
Right.
But when you have multiple lanes, chock-a-block full, then it gets to be hectic. And that's why when you see LA 182 up here, you can bypass the 4-lane and get on 182. And it's going to be dependent on the weather, the traffic conditions, the accidents, if we have any accidents.
Yeah. Okay.
Other than that, it might be smooth going. Well, but everybody has to pay attention,
Yeah. If people are paying attention. Yeah, exactly. So, okay.
All right, sir. Well, that was the one from before. Yeah, it's the same thing.
It's all the same.
We're pretty good on slides right there. And this was just another way to show you how to get around Franklin and everything. We got a plan where if the traffic backs up to Franklin here, then the state police would be up here, Garden City and Centerville, telling people go ahead and start using the alternate route because they could get stuck, bottlenecked up in here and can't get off.
Yep.
So the people behind them, they can start exiting early and go around on the alternate route. And we're just trying to let the OEPs know what our plans are for this area so they can make plans accordingly with their people.
Mm-hmm.
Okay, that's it from me. Thank you.
Thank you, Mr. Guidry. I appreciate you being on today's call. Okay. Kim, you there?
I'm here.
Yeah. I think you sent me this this nice little flyer that folks can run off and they can give it to their staff as well as to their patients. And these are the links that they will need to download emergency alert systems for their respective parishes, correct?
Correct, and as well as the reentry for Lafourche Parish and Terrebonne Parish are on there. Most of them are still on the call. We do have 2 reminders for everybody on the O2 exchange. It is bottles only. When it comes to those concentrators, which was the big thing for Ida, they did find that if you plug your machine into a surge plug rather than plugging it straight into the generator, that helps not blow those out. And then just a reminder that especially when it comes to electric cars, you can go to that surge site and see where there's charging stations, but there is a lull between St. Mary and Iberia Parish. So you would have to recharge in Terrebonne, get back on the road, and hopefully make it to Iberia Parish.
Wow. Oh, Lord, that's right. Mm-hmm.
So just a few more things to think about before the season gets heightened. Again, the National Weather Service gets their new updates this Friday, and they're going to present to this group on next Wednesday. We're hoping for better news, but we'll all find out at the same time.
Yes. The Region 3 points of contact: yourself, Percy Mosley with hospitals, and Charles Kanan. Dr. Kanan was on with us earlier, right? Okay, and then also
everybody should be familiar with their emails because they do require additional forms for transportation. most of the Region 3, we meet pretty regularly out here. But if
Uh-huh.
anybody doesn't know them or needs some more information on them, give us a call. We'll get you in contact with them. It's a little E-Rock form. Nothing major, just where they're going, how they're getting there, what they're sending with them.
Um, uh, do we have any other emergency managers that want to say something to the provider community with regards to their parish or their responsibilities within the region?
Chris, Travis, I think they're happy.
Okay. Yeah,
We cannot thank
Every-
Lori enough for getting that list down. I mean, we had a lot of grays on Fridays, and they really hit that list hard to get it very, very factual.
Thank you. Thank you. I appreciate Yeah, and I really appreciate the fact of what the providers are doing in Region 3. You all win the prize as having the least amount of patients not updated last week. So Region 3, y'all are doing a bang up job in terms of keeping that list as clean as possible. I want to remind everyone that these are lunch and learn topics that you can download and listen to. They're recording sessions. If you haven't, well, these are all in the past tense. So I'll have to get an updated copy for what's happened since June 19th in terms of those recordings. Are there any questions from any of the providers or any of the emergency managers who are on today's call that we haven't addressed yet? Okay, I want to remind everyone that all of these sessions are being recorded. As soon as we are finished today, I will be converting this into a file and connecting it to the slide. So you'll see Louisiana Region 3 highlighted in the future. But I will take this entire slide deck, I turn it into a PDF, and I will be placing that PDF into next Wednesday's calendar invite for this session for next Wednesday. So if you would like a copy of this, you will see it later this afternoon. It will be posted, and you will get a notice that it's being posted in next week's calendar address, the calendar invitation. Next week, we will be covering the at-risk registry. We'll be doing a full tutorial, reminding everyone of how to use the registry. If you have folks again in your agency, I know that it's a job that gets handed on to folks in the agency without not a whole lot of training. We will be doing a full training next week, and I invite you to have your staff in on that particular call next Wednesday, the 14th at 1 o'clock. In the meantime, if you need to get in touch with me, please don't hesitate to call me. That's my cell number, 504-491-6133, or you can reach me at jboudreau@lmhpco.org. You can sign up or have anyone in your agency who is not receiving the calendar invite, they can click on here and then sign up for our calls. We are now 6 minutes away from 1. Are there any last thoughts, comments before we sign off for today's call? We've been lucky so far this hurricane season. We're approaching that 40% chance, 40% mark in the hurricane season. I guess next week we will be going into the peak of hurricane season. So we pray that our protection will continue throughout 2024. If there are no other comments or thoughts, I want to thank you for your attention today, and have a good and safe week in the meantime until we meet again. Thank you. Yes. Let's see. Do we have any